Hello, thank you for joining me today. My name is Miranda Jackson, and I am a senior at Barry University. You are watching this video as part of my DNP project titled Minimizing Anesthesia-Related Medication Errors. I truly appreciate your participation and admire your dedication to improving patient safety. By now, you should have completed the initial pre-survey. Some of this information may be old news to you, but it is so important that I want to bring it to the forefront of your mind. Now, the purpose of this video is to raise awareness of medication errors and encourage the use of preventative strategies so that we can minimize iatrogenic injury while enhancing patient safety. Now, this discussion is based on drug handling and administration. It does not include adverse drug events or allergic reactions. Medication errors are the sixth leading cause of death in America. In the U.S., they injure more than 1.3 million people every year and cause at least one death every day. Annually, 7,000 to 9,000 Americans die as a result of a medication error. It is believed that medication errors impact more than 7 million patients and cost almost $40 billion annually. It is no secret that medication errors are underreported. Just imagine what the numbers would be if all errors were reported. I know we are all familiar with the 6 rights of medication administration. They include the right drug, the right dose, the right route, the right time, the right patient, and the right documentation. There are so many factors associated with medication errors. I listed some of the causes here. The most common are haste, fatigue, and stress, followed by distractions, staffing issues, and inexperience. Additionally, look-alike vials or a change in packaging can cause confusion. Research shows the most reported drug error involved a wrong dose. I'm going to share a few personal experiences I had. My first week of clinicals, my CRNA told me to give rocuronium and handed me a syringe. I went to hook it up to the IV port, but then I realized it was succinylcholine and not rocuronium. Another experience for myself, I thought I was grabbing Tylenol and accidentally grabbed an Ambien. 30 minutes later, I wondered why I was feeling so tired. Medication errors are a huge public health concern that are preventable. It is reported that 1 per 133 anesthetics involve a medication error. In one survey involving 277 surgical procedures, a total of 3,297 medications were administered, and 4.6 involved a medication error. Now, 1/3 of those events caused iatrogenic harm to the patient. Prevention strategies include the use of smart pumps for infusion, using standard concentration, connecting the infusions to the most proximal port, and looking up unfamiliar meds before administration. Using different size syringes for different drugs, like ephedrine has a 5 ml syringe while phenylephrine has a 10 ml syringe. You want to make sure you minimize distractions while preparing and administering medications. Double and triple check the drugs that are pulled. Look at the vial when you pull it out of the Omnicell. Look at it again when you withdraw it out of the vial into the syringe. Label it correctly, and then look at it a 3rd time as you go to administer. A correctly labeled syringe includes the drug name, concentration, date and time of drug preparation, and your initials. The label should be placed on the syringe immediately. Your electronic record may have a barcode scanning option, which would provide a double check of the drug and dose immediately before administration. Granted, the computer decides to work properly that day. Make sure all ports are clearly labeled, whether they're IV, epidural, art-line, phenylephrine versus nitro. You can use cognitive aids or checklists. Reporting errors helps to improve the administration process. We need to create a culture of respect and collaboration that endorses patient safety and establishes compliance. There needs to be a non-punitive system for incident reporting. The goal of this video is to help anesthesia providers be more aware of medication errors. I hope that I have inspired you to be more alert when preparing and administering medications. While you are working over the next 2 weeks, I would like you to take notice of any medication errors, high-risk situations, and any near misses you encounter. Now all you have left is the 2-week waiting period and to complete the post-survey. In 2 weeks, I will send out a reminder for you to take the post-survey. Thank you so much for your participation.